We're back this morning with a Fox News alert. Beau Biden, the son of the Vice President Joe Biden, has died last night of brain cancer. He was 46 years old.
The younger Biden was a lawyer, member of the Delaware National Guard, and former Delaware Attorney General. He was planning to run for governor of Delaware in 2016. He leaves behind his wife, Hallie, and 2 children.
Vice President Biden releasing a statement saying this: Beau Biden was quite simply the finest man any of us have ever known. Well, Beau Biden has faced a series of health issues in recent years, even suffering a stroke. Here to break down his medical history is Fox News Medical A-Team's Dr. Marc Siegel. Thank you so much for being with us.
Good morning.
And you've brought along what to demonstrate?
Well, I brought along the brain itself because I actually wanted it's a model of the brain. I wanted to show a couple of points. One is that it's very easy for brain cancer to infiltrate the brain. So that means people out there may be wondering, how come he had it removed in 2013, supposedly got it all, and then he came back,
Yes.
and he had radiation and chemo? That's because a tumor in the brain infiltrates the brain. It's very, very, very hard to cure it surgically. The front of the brain is where most of these brain cancers occur. Over here, in the front of the brain or on the sides of the brain. That's the vast majority of them. The most common type is called a glioma. That's over 80% of brain cancer. I think, without knowing the facts, that it's probably likely that's what he had.
Do we have any idea what causes brain cancers?
Well, that's a really good question, Tucker, because there are not predisposing factors. It doesn't appear to be genetic, except in some childhood cases. The trauma he had as a young child does not seem to be related. And I want also people out there to know, yes, you know, the prodrome for this is headache or weakness or one side is weak or problems with vision. But if people out there have those problems, the chances are the vast majority of the cases it's a migraine or something else. There's 70,000 cases of primary brain cancer a year, but the vast majority of the time, if you have a headache, it's not brain cancer.
Dr. Siegel, we want to go through Beau Biden's medical history for our viewers. Back in 1972, as we mentioned, Beau was injured in a car crash when he was just a young boy. In May of 2010, Beau Biden was rushed from his home in Delaware to a hospital for a mild stroke.
In 2013, he reportedly underwent a successful procedure. That goes to your point, Dr. Siegel, that you can get a tumor out, but it may come back, especially in the brain. So why is it not a successful operation sometimes?
Well, it's because of that infiltration I talked about, Peter, that it gets into the brain. But here's the good news. A lot of progress is being made right now. Earlier this year, we talked about a polio virus that they're engineering to get in there into the brain and kill the tumor. We're using what's called targeted therapies, immunotherapies, where we've made vaccines out of the proteins of the tumor, using that vaccine to attack the tumor. There's a drug called Avastin that has been successful, that he probably got, by the way, which cuts off blood flow to the tumor and has kept people alive a lot longer. We're not at the game-changing phase yet, but we're getting there.
Interesting. Dr.
And one more point about him. The courage that he showed over the course of his life, losing his mother at the age of 2, being brought up by his father, fighting this disease, never giving up, and then keeping working. That's what being a patient is all about. It's an inspiration.
Yeah, he was a tough, intense man, for sure.
Tough man.
Thanks, Doctor.
Dr. Siegel, thank you.